Hi, my name is Sophie Ndaba, and I am chilling at the amazing, amazing offices of Roche in Cape Town. I'll tell you a little bit more. I'm going to give you more content on what's happening here. But in the meantime, I'm sitting with the amazing CEO of Unjani Clinics here in Cape Town, the CEO, Linda. Super excited to chat to her about, what inroads they've made with their partnership with Roche and where do they want to take this amazing, empowering systems that they've created to make lives easier within the community of Cape Town. Linda, welcome.
Thank you so much, Sophie.
Yes.
To be on the call.
Yes. So tell us a little bit more about why you decided to be involved and why it's so important for you.
So I've been with Unjani Clinics for just over 11 years, and the whole idea behind Unjani Clinics is empowering nurses to operate and own their own clinics in low-income and underserved communities. And so it's just the most rewarding and empowering initiative with Roche as a partner who has funded Unjani Clinics, or some of the Unjani Clinics that are in the network. And it really is about enhancing access to primary health care that's at a quality level and an affordable level.
Wow. Are there any specific programs directed specifically at women? Because I know Roche is very much into, supporting women's wellness as a key, one of their key programs. What is this partnership between the two of you when it comes to women within the clinics?
So a couple of touch points for women. One, most of our nurses are women empowered nurses, and so they run those clinics. 67% of our patients are women.
Wow.
So women's health is a large component of the services we provide, but specifically with Roche focusing in on cervical cancer and creating awareness around cervical cancer and the services that are provided there, but also breast cancer and breast screening and creating awareness and doing screening for those purposes. So very much women focused and the partnership makes so much sense.
And what is it that makes it so much easier with Roche's partnership on women and cervical cancer and testing? Because I think the biggest conversations we had yesterday, because this is our second day with Roche, what is it that allows women to be able to know that when they come to your clinics, they've got access to everything? Are the testers readily available? What is the waiting time for testing to say, okay, I want to check if I possibly have cervical cancer? Breast cancer is another conversation because there's systems where they kind of tell you, okay, this is what you can do at home. But with cervical cancer, what's the process on that in a clinic? Because you think it has to be advanced in an advanced lab. What is it that you do? Is it a pap smear? What is it that you do that allows women to know that, okay, now I can go to Unjani Clinic, and they can make sure they allow me to do this test?
So within the scope of practice of a primary healthcare nurse, those are the services we can provide, and pap smear is just one of those things. We can obviously also do the HPV screening. Self-screening is another option that patients could make use of. The big thing is obviously cost and affordability, but most of our patients would be familiar with a pap smear and would use that methodology. But as we start to educate and use more technology that is currently available, the HPV screening technology is another way for us to do that.
Great. So if I'm a patient and I'm coming into Unjani Clinics and I want to do all these tests, how do I know that these services are provided at Unjani Clinics? Is it something that has advertising all over it, so that when I'm a patient, I'm not just coming because I've got a cough or my baby has a rash, etc. But what are there systems in place that make women, even if you are there for something else, to know, oh, this service is also available? Because community clinics is not a norm that they do pap smears or that they do any other test that we think or deem advanced. What is it that you've got in place that makes me know that, okay, I can do everything here? In fact, I don't even need a specialist. I've got Unjani Clinics.
Well, you would need a specialist because remember, it's within the primary healthcare scope of practice of a nurse. So that's fine. We can do that referral. But certainly in terms of, we on our websites, as you walk into Unjani Clinics, there are also all the services we provide, and it's quite clear in terms of those services. So we could do with a lot more social media out there in terms of what services we are providing, But most of our patients are aware that there are a number of services that are provided by an Unjani clinic, and they can come in for that service.
Great. So how many branches do you have within Cape Town?
So in Cape Town, there are only 4 at this point in time, if we include Kayamandi as part of Cape Town, but 3 in Cape Town, with the hopes that we can expand to more. But we have 250 care settings around the country.
Oh, okay.
So we are underrepresented in Cape Town or in the Western Cape, but it is an area of growth for us.
Wonderful. I think more than 100, more than 10 is always great to make, to change lives. Is it a private owned entity, or is it a more kind of public government funded, government supported? How does it work so that people know that, okay, government is behind this or private sector is behind this? Because it's also great to give kudos where they are relevant.
So the organization that I look after is a non-profit company called Unjani Clinics NPC. It's non-profit, and we raise funding, private sector funding and foundation funding, to create the infrastructure for the nurses, the clinics that they operate out of. The nurse is self-employed, so she's empowered in her business and ultimately owns that business once we have got her to sustainability. And she creates employment in her community and then brings these incredible services to her community. So while we are not funded by government, we are considered private sector. The nurses acquire their medication in the private sector and provide all of their services at private rates, affordable rates of 300 Rand, including medication for a consultation.
Including medication, so you're a pharmacist on site, or are the nurses able to prescribe themselves?
They are able to prescribe. So the way that we look at this is they are dispensing nurses, and they are administering treatment for their diagnosis, which is within their scope.
Within their scope. That's a good one, within their scope. So that makes that gives the clarity to people who want to know more, to say, okay, so if I need antibiotics, I might just be able to get them there if I have a chest infection, etc., etc. Thank you so much, Linda. I think it's been quite insightful, and here we are. Roche is making boss moves and going out there to the community and just keeping up to their mission to say, together we can build a better nation, together we can change lives, together we can save women's lives and give them that extra 5 years or more if the early detection is made through clinics like yourselves, like what Linda is running with Unjani Clinics. So catch us next time on The Roche Know All About It.